This morning, we are dedicating an hour of our show to a live special aimed at taking the shame and the blame out of discussions about mental illness. The CDC estimates 1 out of every 6 adults will have depression at some point in their life. Some psychiatrists now recommend a different approach to the treatment. This alternative uses magnetic pulses to stimulate neurons in the brain. Jamie Yuka spoke to a woman who has tried this treatment. Jamie, this approach sounds a little daunting. What's behind it?
Well, Gail, antidepressant medications and psychotherapy are, of course, the first-line treatments for major depression. These treatments, however, do not always work for everyone. In some instances, this treatment that you're talking about, called deep transcranial magnetic stimulation, might be used as an alternative or in combination with medication as a therapy.
Depression is the greatest thief ever. It robs you of your life, your happiness, your joy.
Marcia Terry has lived with depression for most of her life. At her lowest point last year, she says she was unable to leave her apartment for months.
And I thought, there's no hope. I might as well just get used to it. I'll do the bare minimum of what I have to do in life. Otherwise, I am just going to sit in my chair, do nothing, watch TV.
Terry tried 5 different antidepressants without success. Her husband finally convinced her to meet with a psychiatrist, offering a treatment called deep transcranial magnetic stimulation, or deep TMS.
Then I'm going to tighten it so it should feel a little bit more snug. Okay.
When the person has depression, a certain area of their brain is underactive.
Dr. Aaron Tendler is the chief medical officer for Brainsway. The company's device uses magnetic pulses to create electrical activity and stimulate the areas in the brain that don't fire normally in people with depression.
I would say after the first week, I was for sure sleeping better.
So within the first week of treatment, you saw improvement?
Yes.
Patients undergo 20-minute treatments 5 days a week for an average of 6 weeks.
They can drive, they can go to work. It's highly effective and low risk.
And Terry says these days she's feeling an unfamiliar but welcome emotion, joy.
It's weird. I started noticing things around me more. One thing recently that happened, about a week ago, we were walking home, and I, out of the blue, popped into my head, and I said, I love life. I've never said that in my life before.
You've never said that before?
Never said it before.
Dr. Steven Siegel is head of psychiatry at Keck School of Medicine at the University of Southern California.
It turns out there is nothing we have that's perfect for everyone.
He says the daily sessions can be time-consuming and prohibitive, and the treatment can be extremely expensive if not covered by insurance.
I think it's important people know that TMS is only one of the options available. We have talk therapy, which is very effective. We have medications, which are very effective.
Ready? Ready? Jump.
Even after receiving deep TMS, patients may still experience depressive episodes and need further treatment.
It works so well the first time that if you go through another bout of depression, you'll go back.
Oh, 100%. I will be on that phone so fast. I will never give up again. And I have so much hope.
The device is FDA cleared, but some experts say there is not enough research on who this will help and its long-term effectiveness. They say deep TMS is not for everyone and that people experiencing depression should work with their healthcare provider to find the solution that's best for them, Tony.
Yeah, not for everyone, but hope is the word. And if this helps some people, that's a good thing. Jamie, thank you very much.
Just think if you've tried 5 different treatments and you feel that you're being robbed of your joy and you think, this works. I see why she says, yeah, I would do it again.
It's another weapon against the wolf, right?
If you're in that position, it's like anything it takes. You know?
Yeah. All right.